There's many different roles within the OB field. We have labor and delivery nurses who help moms through, they may have a triage issue early in their pregnancy, antepartum related issues that we help those moms through, as well as when they come in for their labor and delivery experience. And that's everything from the admission process all the way through birth, through that recovery period. And what is amazing about our nurses at Shawnee Mission is that they're committed to working with the patients. We're here for them. We sit down with every patient and we want to know what is your birth plan, and we go above and beyond to make sure we're able to meet that, whether it is a low intervention birth or it's a high risk birth, where we need to use our technical expertise and have specialty teams on standby. So the girls are committed to really working with the patients of what do they want their plan of care to be, and making sure that we meet that need. We have maternity care coordinators who are OB nurses who meet with all of our patients prior to delivery around 36 weeks. And that's an opportunity before they come into delivery under a controlled environment to talk about those things of what do they want their birth plan to do or to be. Do they want a low intervention? Do they want to use one of our birth tubs? And do they have any high risk situations where we can set them up prior to coming to the hospital of needing to meet with a high-risk perinatologist if they want to meet with one of the neonatologists because they're at risk for a preterm delivery, or maybe one of the anesthesiologists because they have questions about options for epidural and different pain options during delivery. I think the key word when you talk about how do patients benefit with an experienced team is that word teamwork. It's not only just the nurse, but having a full experienced team surrounding that patient. And like I said, we meet with each patient, so whether that be a very low risk birth or a high risk birth, and we actually do simulations and training with not only the nurses, but we involve the physicians that attend those simulations, the anesthesiologists, and the entire care team to make sure that we are up to date and the latest and the greatest. Part of being an OB nurse is having that mixture of compassion and technical expertise and knowing how to combine those two, being at the bedside, doing the low interventions when it's appropriate, but yet being able to switch over modes in any of those emergency situations. Being an OB nurse to me, it means the world to me, and it means the world to my associates. This is, yes, a job, but OB nurses go into this field because it's what they're compassionate about. They want to give back to our community, to our patients, and it's a love, it's a drive that brings our nursing here. The nursing care at Shawnee Mission really is driven by compassion, and that's what makes us special at Shawnee Mission, and that's what brings more patients to Shawnee Mission to have a baby each year than any of the other hospitals in the region. Being the manager of the labor and delivery unit, I am blessed to work with such a compassionate, experienced group of nurses. I get the pleasure of getting to see the letters and the thank you notes and the comments through surveys that patients send back. And it absolutely makes my day to know that the hard work that those girls are doing every day is paying off, and it's making a difference in our community. We have patients who come back up and bring gifts and things to the nurses. They never forget their nurses, and for years send cards and thank you notes. So I'm proud to work with such a compassionate group of nurses who work so hard to meet the needs of our patients. I'm April Crouch, and I'm the Clinical Manager of Perinatal Services at Shawnee Mission Medical Center.